First, I would like to say that I am over the moon to be a part of this gala. 25 years is a long time, and I have been a part of it from its inception as the first chair of special events. So to tell you what our hospital and its growth has been to us personally, I would not know where to begin.
My name is Bill Horney. I've been around a long time, and I'm glad to be here today. As a matter of fact, I'm glad to be anywhere today. I think about Bill Aldridge and his wife Elizabeth, and how 25 years ago they put together $258,000 and we started what is now our foundation, our endowment. And look where we are now. Back in the beginning, we had just raised in this community over $10 million. And we had to ask ourselves, could we embark on an endowment? Is the money there? Will people continue to support us with what we need to keep this hospital going? And we felt like we had to do more than build a hospital. We had to take care of it once it's built. And so we started what was a tiny endowment. And it's just been wonderful.
As our own gifts to the hospital, my husband and I wish I could say it was all altruistic and philanthropic, but there was a big selfish part in wanting the best of state-of-the-art care. And from everything I can observe and from our own personal needs in the last few years, both Jack and me, our hospital is serving us well in its state-of-the-art ability to serve health needs. So, to give detail of what High Point Regional has meant to the Slane family, I would need more time than you have tonight.
The hospital foundation has been extremely valuable to us over the years. As physicians, it's very important to us that we can provide the best care possible for our patients, and we just would not have been able to do that if it wasn't for these contributions.
My name is Barry Cheek. I've practiced cardiology here at High Point Regional Hospital for 24 years now. Doesn't seem that long. Time flies really fast. I've had the honor and pleasure of working at High Point Regional Hospital, and I've seen what the endowment has helped do for our hospital. Not only would our hospital probably not be here at all if it weren't for the generosity of our community through the foundation. We certainly wouldn't be supplied with the technology that we have now to work with. And that technology makes a difference in my practice and for our patients every day. We see it firsthand and use it and feel it. You'll be hearing from Roz, who will give a testimonial about living proof. She's one of many patients. We have many examples of patients who have directly benefited from the technology and the facilities we have here at High Point Regional Hospital. And without the generosity of the community through the endowment, this would not have happened. It would not be possible.
Our family has experienced heart disease since I was the age of maybe 5 or 6. I've had several uncles to pass away. My brother died of a heart condition at the age of 25. I just lost my mom 3 years ago to the same disease at the age of 65, and my sister just last year at the age of 35. So being the mom of 3 very active fellows, I would have never thought that I would inherit the condition. I'll never forget it. October 1st, I found out that I had congestive heart failure and that my heart fracture was at 25 and the normal is 50 to 60. To hear that I had the heart condition that the family has been fighting for years, I was very scared for my boys to leave them here without a mom to do things on their own. Afraid for my family to go through so much hurt again. After seeing my primary care doctor, she referred me to the cardiologist over at High Point Regional Hospital. I went in to get the normal EKGs, stress test, and ultrasound. After doing the ultrasound, it was no way I could do the stress test. They wouldn't even allow me to get on the treadmill. So my heart was actually functioning at half the capacity.
We've been fortunate enough at High Point Regional Hospital and the cardiovascular program to achieve a lot of awards and a lot of recognition, which are based on aggregate statistics. But what we see every day is that these statistics are based on treating one patient at a time and one success story at a time. And Roz is a great example of that. It's a real pleasure to see these success stories every day in my practice here at High Point Regional.
My surgery from High Point Regional was amazing. Coming from another state, not even knowing the hospitals around the city or the towns, I couldn't have asked for a better facility. I was relaxed, they treated me very well, and they took good care of me. Being an active sports mom, it was very hard for me not to see my children play. To be able to get back in the stands to cheer them on with my new defibrillator was so amazing.
We're very proud of our cardiology program. It really has been recognized nationally for the tremendous job it does for this community. But there's another side that's so important to this community as well, and that's our cancer program. It's very important to us, it's very personal, and it's one of our shining stars at High Point Regional.
I thought I had pneumonia, but as it turned out, I had lung cancer. I had an 11-centimeter tumor, a tumor the size of my fist in my lung. I go for my chemo appointment. They do the lab work, and I'm checked into the upstairs at the cancer hospital that day on December 23rd. I have multiple blood clots in both of my lungs. Fortunately, I didn't know at the time the survival rate of blood clots, and when they are in your lungs. But 3 days later, I was released. But my journey still wasn't over yet. I still wasn't feeling quite right. So my wife takes me over to my oncologist, Jason Huff. We do lab work, and it turns out I had a blood sugar reading of 876. I was diagnosed as a diabetic.
I had a lump in my throat, and I felt weak, and at that time I went to the doctor because I didn't know what was wrong with me, and I found out I had non-Hodgkin's lymphoma cancer. Right before treatment, my wife became pregnant, so I was blessed with a baby girl during this whole time of the treatment. When you find out you're having a child, it's very emotional, but whenever I had the cancer, it really changed perspective on life, especially with my new daughter. I was very scared because I didn't know what the future of my family would be. I didn't know if it would be anyone there to take care of my family. So it's a very scary thing. I was led to High Point Regional by a fellow that I'd met whose daughter had gone through the same type symptoms and same non-Hodgkin's lymphoma that I had. And he told me about Susan Williford and her staff, and that's why I went there. I really appreciate what they did for me. They made me feel very comfortable throughout the whole chemo, the whole treatment. I had some ups and downs through the treatment, and they really took good care of me. I felt like I was in very safe hands with Susan Williford and her staff.
It's been quite a journey. And I feel that I owe my life to the care and the support that High Point Regional was able to provide me. I must have come to High Point for a reason, and I'm awful glad I did. I don't feel that I would have received the care and the attention that I have received from High Point Regional. That I don't think I would have received that anywhere else.
I'm back living a normal life now, doing the things I've always done, and feeling the same I feel now as I felt before I did the chemo.
High Point Regional allowed me a second chance at life, and it's a chance that and an opportunity that I don't take lightly. I plan on sticking around for a while, and I owe my life to High Point Regional. truly do.
There are stories like these that happen every day at High Point Regional, and we're so proud of the results that we've been able to achieve over the last 25 years. And it's been from people who have supported us during this 25 years that have really made it possible, and the leadership that has come forward from this community. Leaders like Bill and Elizabeth Aldridge when they gave their original gift to make the endowment possible, and also leadership like Marcia Slane and Bill Horney, who really and truly have made this a part of their lives.
One of the things that I've gotten out of being involved with this hospital for more than 50 years are the people I've had an opportunity to work with. It's just been a mountaintop experience to me to be involved with the people that are about this hospital.
It has been the most wonderful experience to witness the generosity of the citizens of High Point who recognize the importance of state-of-the-art care and that our hospital is the center of our region to offer this kind of care to everyone. And that has proven to work for what we wish to do. Thank our citizens. Thank them for the foresight and the generosity and the will to make this happen.
On behalf of the medical staff, I'd like to thank all the donors for what they've done for us over the years. Their contributions have been invaluable, and for that, we on the medical staff are extremely grateful.
In my 24 years here, I've seen an enormous growth in technology. We have much more than we had 24 years ago, but yet we need more things. And things are changing every day in technology, and we need to keep up in order to offer our community that supports us to turn back to the community and give them what they deserve, which is a first-rate hospital. And that's a daily process. If you take your eye off the ball, you fall behind. So our objective is to have the best cardiovascular service anywhere around there, or anywhere in this region. We think we have that now, but it takes the community and they're an invaluable part of the team.
It's just a wonderful experience to be a part of something as grand as what we have in this community, in this hospital.
We love being a part of not only this community, but certainly our hospital. And we are so grateful for everyone, all of the staff, and the people who make it such a special institution. So when I look back down the road and reminisce about these many years, it is with such pride that I am thinking of the 25 years, the wonderful chairmans that have followed from that first event and have only made it more elegant, more exciting, and really what would be a State of the Union, it is our State of the Hospital opportunity to share all of the deeds and the needs of High Point Regional Health System. I just cannot thank each and every one of you enough, and for you to remember that this gala evening is in your honor with great appreciation. Thank you.